The first test that I will be doing is the Weber test, and that will be done to check equilateralization in the patient's ears. So I'm gonna place this tuning fork in the middle of your head and let me know when you're done hearing, when you're not able to hear it. Were you able to hear it in both ears or one ear?
Both.
There is equilateralization in the patient's ear. Next, I will be checking for the Rhine test and to see whether air conduction is greater than bone conduction or bone conduction is greater than air conduction. And I will be timing it. Just let me know when you're not able to hear the ringing anymore when I place it behind your ear.
Done.
Okay. And now I'll be assessing the patient's right ear.
Done.
Okay. So air conduction is greater than bone conduction. Next, I will be performing a whispering test, and you have to repeat everything that I whispered in your ear.
Halloween is right around the corner.
Patient was able to state the sentence that I whispered in his ear. So now I will be doing an oral exam for my patient. First, I will ask him to smile and show his teeth. Cranial nerve 7 is intact. Smile is symmetrical. Can you please smile again and show your teeth? All of his teeth are intact. Open up for me, please. Patient's lips is pink and moist. His buccal mucosa is also pink and moist. Can you please stick your tongue out? Patient's tongue is intact. Stick your tongue out, please. Open up. And it's also midline as well. Can you please wiggle your tongue? Patient's hypoglossal nerve, cranial nerve 12, is also intact when it comes to tongue strength. If I were to have a tongue depressor, unfortunately, I do not. I would check the patient's gag reflex to see if it's intact. And I would also check if the tonsils are within the tonsillar fossa. And also I would check if the uvula is also midline as well. But as far as the ones that I was able to assess, patient oral mucosa is within normal limits. Neck, the patient's thyroid is not palpable. There's no lymph nodes, but the trachea is midline to the body. I will also be doing a chest assessment. Patient's chest is symmetrical, the front, and can you please turn around, and to the back As well, I will be doing percussions of the chest in the right upper area. Can you please turn around? And I was able to prove there is resonance in the patient's lungs. Next, I will be checking for tactile fremitus. And can you please put your arms down? And you're going to say 99 for me, please.
99.
And turn around. And say 99 for me, please.
99.
Patients, there is fremitus felt as I palpated and asked the patient to say 99 for me. I will also be doing auscultating the patient's lung sounds, interior and posterior. And I'm gonna ask you to take a deep breath. Take a deep breath in. Breathe in. Breathe out. 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 Patient's breath sounds anteriorly are clear, and I hear vesicular sounds in all lobes of his lung, and I'm gonna ask him to turn around. Okay. Breathe in. Breathe out. 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 Patient's breath sounds are bilaterally clear, and I hear vesicular breath sounds bilaterally. As my patient is laying down, I am assessing for JVD as he is laying down and his head turned towards the right. The patient's jugular vein is not distended and is also flat as well and not palpable.